Okay, good afternoon, everyone. Wanted to welcome you to today's virtual community health talk. My name is Brian Green. I'm a field clinical representative with Inspire. Today, we're going to be hearing from Dr. Omid Medizada from the Pacific Neuroscience Institute in Santa Monica, California. Dr. Medizada is an otolaryngologist and head and neck surgeon, native of Los Angeles. He graduated from University of California at Berkeley, or received his medical degree from University of California at the Davis School of Medicine. Dr. Medizada then completed his residency in otolaryngology and head and neck surgery at New York University, as well as a fellowship at UC Davis in Sacramento. Today, Dr. Medizada will be discussing treatments for obstructive sleep apnea, including the implantation of Inspire therapy, which he currently performs at Providence St. John's Medical Center in Santa Monica. So Dr. Medizada, the floor is yours. You can take it away.
Good morning, good afternoon, everybody. Thank you, Brian, for the introduction. Thank you for joining us today. Thank you for taking the time out to learn about this wonderful device. As Brian mentioned, I'm Omid Medizada, ENT, ear, nose, and throat surgeon, as well as head and neck surgeon here at the Providence St. John's Medical Center in Santa Monica, California. So let's get started. So just a couple of housekeeping things. This meeting is going to be recorded. So please make sure not to share any personal health information. Of course, if you have any questions, it's always best to keep it general or specifically without any identifiable information. If you have any questions, feel free to chime in. Brian will be taking all the questions, and we'll have a Q&A session at the end of the session. You'll be able to just hover your mouse at the bottom of the session where the Q&A icon will pop up. And then from there, you could go ahead and send a message to us, and we'll make sure to take a look at it and answer it. So what is obstructive sleep apnea? Today, specifically, we're going to be focusing on obstructive sleep apnea. There are different types of sleep apnea, including central apnea, which specifically has to do with the brain not sending signals to the body to take a breath. But in this case, obstructive sleep apnea, as it sounds, is our body in our sleep attempting to take a deep breath. However, unfortunately, structures within our throat are blocking that air from getting into our lungs. Essentially, when we go to sleep, our muscles relax. Otherwise, we'd be acting out our dreams. So structures that usually are staying out of the airway from our nose and as well as our mouth, like our tongue or our tonsils, or the back of our throat, like the uvula, which is a little dangling thing that's hanging in the back of the throat, those things are generally rigid and allowing us to breathe comfortably. However, upon sleep, especially REM sleep, our body goes into a full relaxation mode, and these structures, as indicated by these images, can fall back into our airway and essentially block our breath. In this process, even though we're trying to take a deep breath, we're not able to. Our oxygen is not seeing that. Our lungs, are not seeing that oxygen, and then ultimately our brain is not seeing that oxygen. I have seen situations where someone's oxygen level is going down into the 60s, meaning 60% or so. To give you a relative baseline, our normal oxygen level is 98 to 99% when we're awake, and then it can go down to approximately 93% when we're asleep. But imagine numerous times per night your brain not seeing oxygen as it's supposed to. And of course, that has numerous consequences, from how we feel throughout the day, waking up with headaches, essentially having poor energy, feeling lethargic, in really severe cases, dozing off involuntarily, for example, at our desk, watching television, or in severe cases while even driving, to mood changes, feeling depressed or anxiety. Untreated sleep apnea has been demonstrated to increase the risk of major depression. And then, of course, there's long-term issues associated with obstructive sleep apnea. For example, it can have quite a significant strain on our heart, on our lungs, increases the risk of early dementia, high blood pressure, diabetes, and the list goes on and on. So I like to compare treating obstructive sleep apnea to basically being able to pick low-lying fruit. In our everyday life, we're constantly trying to make ourselves feel better. We're trying to improve longevity. So many of us are exercising, trying to maintain a good diet. Of course, there's so much out there on supplements and nutrition, but if you do have sleep apnea, obstructive sleep apnea, truly treating it has shown to improve your life, both life quality as well as lifespan. And of course, just your partner, if you have a bed partner, all that snoring and choking in your sleep, I could definitely attest to it, how many times I've been poked and prodded to turn over onto my side when I've been snoring. So there are numerous interventions or treatments for obstructive sleep apnea. CPAP therapy, which stands for continuous positive airway pressure, is the mainstay or a gold standard of treating obstructive sleep apnea. Essentially, CPAP is just providing pressure or air into our throat and preventing these structures from collapsing and basically keeping the airway open. Of course, for many people, it's a wonderful option. It's low risk, it's effective, but for many people, it's not something that's reasonable for them. Whether it be social reasons, i.e., dating, it makes a lot of sense. A lot of people don't want to have to take out this huge CPAP machine and put it on right next to their new date. I'm not sure how that does for the relationship. To traveling, to claustrophobia, to stomach sleeping. So in general, we like to recommend CPAP as the first line therapy for sleep apnea. However, many of our patients do decide that it is not the best treatment option for them. Depending on the severity of sleep apnea, there are other treatments outside of CPAP. For example, one can see their dentist or a jaw specialist and get fitted for a specialized oral device called a mandibular advancement device. This is essentially a bite guard that locks into the upper as well as the lower teeth and moves the lower jaw forward. In that, it moves the tongue out of the way and opens up the airway. Improving nasal breathing by resolving nasal blockage can also improve sleep apnea. And both of these first two are generally reserved for patients with mild to moderate sleep apnea. And the severity of the sleep apnea is usually scored based off of the number of obstructive events per hour, i.e., how many times someone holds their breath or stops breathing in their sleep per hour. That score is commonly called the AHI, or the apnea hypopnea index. And then moving forward, there are numerous surgeries for obstructive sleep apnea. And generally, these surgeries aim to either adjust, restructure, or remove whatever is causing the blockage, whether that involves neck surgery, tongue surgery, throat surgery, some of which can be quite painful and recovery can be quite difficult for at least 2 weeks or so. And that's where Inspire comes in. Inspire has truly revolutionized the way we treat apnea, sleep apnea, in the sense that it is a highly effective device that moves the tongue forward during sleep. It's different from pretty much every other type of surgical intervention, is that it's not doing anything awake. It's not changing your normal anatomy. It does not involve cutting anything out of the throat or making any incisions in the throat. It does not involve changing the shape of the face, which some sleep apnea surgeries do for quite severe sleep apnea. But essentially, Inspire is a device that stimulates the nerve of the tongue that moves the tongue out of the way. So when someone goes to sleep, the device is turned on and the tongue is moved forward in our sleep. The amount of stimulation that's required to move the tongue forward is actually tolerated quite well. And that's a function of gently increasing the power of this device. So what happens is there's a couple of implants, or two implants specifically, that go into the body. One is in the chest and the other is in the neck. And in the chest is the device that senses when we take a deep breath, sends a signal to the device that's in the neck that stimulates the nerve of the tongue and sticks the tongue out. And this can be turned on and off as we wake up and when we go to sleep. Some quick details as to the procedure again. It does require two small incisions. One is over the right pectoral, the right pec muscle, about the mid to upper chest, and the other is a small incision directly under the jaw. We tend to do these on the right side generally, but there's always exceptions. The procedure is an outpatient procedure. Go home the same day, and pretty much most of our patients, most of the people who have this device implanted are quite functional within 3 to 5 days, which in its own right is a quite remarkable feat for having a very effective treatment for surgical treatment for sleep apnea. As I mentioned before, with some of these throat surgeries, people are taking time off of work, having to maintain a soft diet for about 2 weeks or so because of the pain required with these throat surgeries. Some people do experience some strain in the chest or the neck, but like I said, that goes away quite quickly. The device is MRI compatible, and there are no issues with metal detectors or anything else of that nature. And we have the data as well for this device. This is one device that we actually have data that goes back at least 10 years and actually shows its efficacy or its effectiveness is improving with time rather than decreasing. Unfortunately, with some other surgeries, the data shows that these surgeries actually become less effective, but that's the opposite with Inspire. So the data has shown that thousands of patients who've received this device, at least 90% of them are quite happy and would recommend it to somebody else. And patients are using it at almost 5 to 6 hours a night. And we do basically cut off the criteria for which we consider something effective is use for at least 4 hours, and we're definitely far past that. On average, patients or people who receive the device are nearly have what's called severe sleep apnea. That's the number 29.3 that you see on the left-hand side there. That's the AHI, or again, the number of times per hour that the breathing is obstructed. Anything more than 30 events per hour is considered severe. And then you can see that it's going down to 6.2 with using Inspire, which is just above normal. Less than 5 events per hour is considered normal. But for all effective purposes, with a number of 6.2, energy is improved, quality of life is significantly improved, and the long-term risks associated with obstructive sleep apnea are no longer there. And then, of course, most importantly, your partner is happy. A significant reduction in snoring from 83% to 10% reporting snoring after the device is implanted. There are certain qualifications that one needs to pass. Age is one, at least 18. The weight is also a factor here. In general, if your body mass index is less than 35, it can get approved. There's always exceptions. There's always exceptions for that as well. But less than 35 is a criteria. As mentioned before, there are certain types of sleep apnea that are not obstructive sleep apnea. Some of those may deem you not a candidate for this as well. And ultimately, we do a procedure called the drug-induced sleep endoscopy, which is a quick procedure in the operating room that's non-invasive, basically putting someone to sleep for 20 minutes, taking a look at the throat, seeing what the pattern of collapse is, and then determining off of that what best qualifies you for Inspire. And even with regards to that, there are only strict criteria by which we say someone is not eligible for the device as well. So, of course, it's always best to discuss this with your doctor or your surgeon, and then the people like Brian, as well as a lot of other representatives from the company, have been really helpful in helping my practice get these devices approved with our insurance companies. So, don't worry about the insurance aspect. Let the offices deal with that, and we tend to work things out quite often. So I'd like to introduce Karen. Karen is a patient who had quite severe symptoms of sleep apnea. She had her device implanted in July of 2018, and I'll let her tell you her experience, but I believe that it's essentially changed her life.
Yeah. So Dr. Medizada, I'll go ahead and step in here. Unfortunately, Karen had a last minute family emergency and is not able to join us for this call. She really does apologize. I have heard Karen talk about her story a few times, and essentially what it did was it really changed her life in a multitude of different ways. Speaks specifically to her memory, her energy level, and her weight loss as well. Just more energy during the day. As you can see, her pre-implant AHI was 20 or 20 closures per hour, and is now down to 4. Which we deem a huge success, so almost a curative therapy. And so she really apologizes for not being able to hop on last minute, but she is also a patient ambassador for us. Again, this is totally unpaid. She's a volunteer. And if you'd like to speak with Karen personally, you can go on inspiresleep.com, click on patient ambassadors on the top right corner, and set up a time for a 15 to 20 minute call with her. She can kind of go through the qualification process, through the surgical procedure, recovery, and then the fine tuning that goes with Inspire. There's an activation appointment that comes a few weeks after the surgical procedure. We then self-titrate up until we get a curative voltage that is also comfortable for the patient and also is opening the airway in the appropriate way. So it usually does take a few weeks after the activation to get to that point. They then go in for another sleep study with Inspire on to confirm that their apnea is being effectively treated. So that's kind of the process we go for patients. Again, if you'd like to speak with Karen, you can go on inspiresleep.com. You can click on patient ambassadors, put in your zip code, and Karen will appear for Southern California. So again, apologize she's not able to join us. But again, that's just another way that you can contact Karen and hear her story.
Yeah, I remember. I believe I met Karen once at an event, and here you mentioned about her cognitive changes. She was having significant memory issues with her associated with her sleep apnea. She was having a lot of issues with work, and after she had this, and she tried so many different other interventions, including surgery, as well as a CPAP machine. And ultimately, she found Inspire, and it's made such a significant improvement in her life. Yeah. So this is my information. I think, Brian, did you want me to say, or were you going to go ahead and take some questions?
Oh. Yeah, absolutely. So these are the two offices we can call to set up a consult with Dr. Medizada to speak further about Inspire and if it's the right therapy for you. So we'll leave this up here. Again, both offices are in the Santa Monica area. But we do have a couple questions that I'll just jump right into. Again, folks, if you have any questions at all for us, you just hover your mouse to the bottom of the screen. You'll see Q&A. You can click on that. A text box will appear, and you can just type your questions in, and I'll go ahead and read those off to Dr. Medizada. So we have a few. Can you use Inspire if you have a pacemaker?
Yes. So specifically, that's a great question. So specifically, as I mentioned, we do implant Inspire on the right side because traditionally pacemakers are implanted on the left side. So we're on the opposite side of the chest, and the two do not interfere with each other.
Okay. Next question here is, what does the device feel like internally? Can patients feel it?
So you cannot feel in the acute phases after surgery. There's of course some tenderness in the area, as well as some fullness in the neck. But over a period of weeks, that does go away. In terms of actually feeling it with your hand, you cannot feel the device in your neck. The device that goes in the chest is approximately 2 by 2 inches. You cannot see it. If someone looked at you, they would not be able to see the outline of the device. But if you pushed into the chest with your hand, you would be able to feel it. But it's sitting above the pec muscle, but it's sitting deep to some layers of skin and fat. So quite truly, it's not anything that anyone would ever notice. But of course, we ask not to push into it too hard because the wires are attached to it. And additionally, there is a wire that is attached from the neck to the chest, and that cannot be felt as well or seen.
Got it. Okay. Next question is, what are the risks of having Inspire? I think this is related to the surgical procedure, if there's any risks related to that.
Another great question. So essentially, with the surgery itself, there are certain risks associated with implanting the device. Specifically with the chest, since this pacer, which detects our breathing, goes on the chest wall, there is a less than 1% chance of causing what's called a pneumothorax, which is essentially a puncture in the chest wall, causing some escape from the lung of air, causing some escape of air from the lung. We do test that out during the procedure. We do make sure that that's not happening. But again, the risk of that happening is quite low. As with any implant, there's a risk of infection, but I believe the percentage rates, Brian, I'll let you attest more to that, but the reason to take that device out because of infection has been less than 0.1%. Is that correct?
That's correct. Yep, less than 0.1.
Okay, so the risk of infection, even though it is a device, is extremely low. In the neck, there are a few structures which the surgeon has to be quite careful of, specifically 3 nerves. One is the nerve that moves the lip. We're in the neighborhood of that nerve, so the chance of an injury to that nerve is also less than 1%, but we don't tend to get anywhere near it generally. Of course, this device is being implanted onto the nerve that moves your tongue forward. So some people describe a little bit of a change in the sensation of motion of the tongue, but there's never any changes of speech associated with that or swallowing. And then lastly, the nerve that controls sensation, numbness of the tongue, is also in their neighborhood, still quite far away, but essentially also less than 1%. So any of these risks, which is quite remarkable for any surgery, is less than 1% specifically for this surgery.
Yeah. Next question, what if you also have nasal blockage as well? How effective is Inspire?
Great question. So Inspire has allowed me as a surgeon to circumvent performing nasal surgery generally at the same time. If someone has severe nasal blockage, if I was doing inherent throat surgery, meaning restructuring the throat, I would also operate on the nose to help someone breathe. But if someone has mild to moderate nasal blockage, I tend not to help the nasal breathing anymore. But that's, of course, unless someone wants me to perform the surgery, which can be done at the same time. But because specifically Inspire is stimulating the muscles of the throat and dynamically moving things out of the way, whether you're nasal breathing or mouth breathing, nasal breathing hasn't been shown to significantly change the effectiveness of the Inspire device.
Next question, it's kind of specific to this patient. I have a C1 T2 fusion and a spinal cord stimulator. Does Inspire also work with them? Can you also have Inspire?
That's a great question. It depends where the nerve stimulator, or excuse me, where the C1 stimulator is placed. I believe if it's placed in the back of the spine, it should not be a problem. Of course, you would want to check with your surgeon for that. But I believe if it's placed in the neck, in the front of the neck, then we would have to perhaps change the operative plan, whether the implant would have to be placed on the opposite side. But Brian, I'll ask you, in terms of magnetic or electrical stimulation energy, is there any contraindication to that?
Nope, there is no contraindications for that. I mean, as mentioned, we typically have to make a decision on whether we want to implant on the right or left side. Typically, these are implanted on the right side, but they can be implanted on the left. But there's no contraindication for any spinal cord stimulator. Next question: how long are the incisions that are made to install the device?
Each incision is slightly less than 2 inches, excuse me. So 4 to 5 centimeters, so slightly less than 2 inches.
Okay. It says, is there an alert at the TSA in airports?
No, there is not.
Okay. I'm on blood thinners. Can I have the surgery?
You would need to, yes, the answer to your question is yes, but the blood thinners would have to be held for a certain number of days before the procedure, whatever is deemed safe between your surgeon as well as the physician that manages the blood thinners. And then we resume the blood thinners the next day.
Okay. Are you asleep during the procedure? Totally asleep.
Yes, totally asleep. This is general anesthesia. You're completely knocked out. You have no idea what's going on.
Yeah. Next question. I am a mouth breather, full CPAP mask. Are there any concerns with being a mouth breather?
So again, relating to the nasal obstruction, if it's quite severe nasal obstruction, we would talk to you about how to help you breathe better through the nose. But no, there is no reason not to pursue Inspire. There's no contraindications to performing Inspire with nasal blockage.
Okay. And just a question: can the procedure be undone as far as a possible explant? Is it possible to remove?
It is possible. Yes, yes, it is possible. I think the explant rates are less than 0.1%. One of the reasons we do the drug-induced sleep endoscopy, one of the reasons we do counsel our patients quite extensively before the surgery, especially me, as well as I'm sure many other surgeons, is we want to make sure that you're the right candidate for this device. But if needed, it can be explanted. That's right, it can be removed.
Mm-hmm. And how long would you estimate it takes to dial in the Inspire device to your sleep apnea after it's implanted? Does it usually take weeks or months?
Brian, do you want to take that one?
Yeah, absolutely. So this is kind of my role, just making sure that we dial in a very comfortable, subtle stimulation. Typically, patients say it feels like just a very slight tugging at the back of the tongue. Definitely something that you can sleep through. And typically, I would say it does take about 1 to 2 months to really dial that in. We start the stimulation at a very low level. As your body acclimates to the stimulation, we're going to ask you to using your Inspire Sleep Remote, step up 1 level per week. And typically that needs to be done for about 3 to 5 weeks. At that point, we'll start to feel some real subjective benefit, meaning that we're hoping that you're sleeping more through the night, waking up feeling clear-headed and not as tired during the day. Once we achieve that level of subjective benefit, we'll then bring you back into the lab with the Inspire on for the night. And then the hope is that we get some real data showing that your OSA or your obstructive sleep apnea is being treated. Typically, that study is about 3 months after the activation. But typically, as far as some subjective benefit and really feeling like you're getting better sleep, we usually see that in about 3 to 5 weeks after your activation appointment. Let's see. Does insurance approve BMI over 40?
I believe with exception, but Brian, you may know more about that than I do.
Yeah, so the Medicare requirements for BMI are under 35. We did receive approval from FDA last year for the BMI cutoff to be at 40. However, most of the commercial payers have not updated their policy yet. However, we expect them to later this year. So to answer your question, does insurance approve BMI over 40? At this point, no. That is the cutoff. We're happy to submit if to any insurance provider. However, there may be a denial with a possible appeal over. But I would say we want the BMI to be under 40 at this point in time. And just a clarification, the actual procedure is done with general anesthesia and no propofol. Is that correct?
Well, propofol is used for general anesthesia. So yeah. But the most straightforward way, it depends on the anesthesiologist, but most will use propofol as the general anesthetic.
Okay. And just a few more questions here. Is blood transfusion ever an issue?
There's no significant risk of bleeding with this procedure, so we don't anticipate any blood transfusion. Actually, quite remarkably, blood loss is minimal, quite minimal. I'm talking about less than, um, significantly less than half a cup.
Okay. And it looks like the last question here. What if you have consistent shortness of breath? Is that at all related to qualifications for Inspire? Would you recommend Inspire for this patient?
So it depends, of course. That the determination would have to be what is the cause of the shortness of breath. Is it associated with the sleep apnea, or does it have to do with something completely differently? But shortness of breath, it's quite, I would have to say it's quite a general symptom that would need to be worked up. Um, but in general, other than the criteria that we had mentioned, as long as a chronic condition is managed, it's generally not a contraindication to implanting this device.
Okay. All really, really great questions here from our audience. I also have good news. Karen was able to join us. She's just running behind a little bit, which is no problem. So Dr. Beyzadeh, if you don't mind going back to the last slide, I want to just intro Karen and she can kind of share her story. Karen, I also mentioned that you are one of our patient ambassadors on a volunteer basis. So if patients have any questions for you, they can go on our site and set up a time to speak with you over the phone. But while we have you here, we'd love for you to share your story.
Okay, great. Can you hear me okay?
Yeah, you sound great.
Okay, I'm on cell signal, and let me know if it starts to get bad, and then I'll switch to try and get on Wi-Fi. So sorry about being tardy to your patient talk, but my name is Karen Wolk, and I am, as you already know, a volunteer patient ambassador for Inspire Medical Systems. I got implanted in July of 2018. Previous to getting Inspire, I actually didn't get diagnosed with obstructive sleep apnea until I was 45 years old. And it turns out that I have the airway anatomy for it. So I probably had it, the doctor said, since I was born, and I was just born this way. But as I've gotten older, that sleep apnea that, let's say I went in at 45, was at a 9.6 AHI, apnea hypopnea index. So that increased rapidly between then and when I actually got my Inspire. So I was at 20.6 by then. And I definitely felt the effects of sleep apnea, and I was going to a lot of different doctors starting in late 2011, a lot of specialists to try and figure out what was wrong with me, because I was having memory issues, word finding problems that turned into other things that eventually got diagnosed with a mild cognitive impairment. And I was having trouble remembering even people that I knew, people I had met recently, where I used to, be able to have a normal life. I was mostly not able to function, and on work disability, and mostly going just to doctor's appointments. And other than that, I am just trying to feel better. So I spent a lot of time in and out of work disability. And then I tried the CPAP after getting my sleep study. I accidentally got diagnosed because I was taking my daughter to a sleep doctor for restless leg syndrome that was suspected by her physician. And so when I went in there, the doctor took a look at her airway and then wanted to look at mine to find out if she got her narrow airway from me. And apparently she did. So I made an appointment with her for a sleep study and found out that most of my symptoms over time found out they were caused by my sleep apnea. And the other symptoms were made worse by it. But the mild cognitive impairment wasn't getting any better with CPAP. I tried that for a year, and I did get nasal turbinate reduction so I could tolerate the mask. Then I tried BiPAP for a year. And I also noticed that I didn't feel good in the morning. So like the happy face on the machine saying I was compliant and using it that I get every morning, I wasn't happy and I wasn't feeling any better. And then there's a test that I would assessment that I would take every time I go to sleep doctor with the Epworth sleepiness scale, which would determine how sleepy I am. And I was always very high on the score because I was very sleepy. I had trouble holding conversations, watching television, even following a storyline was difficult. So I'd end up having to watch things over and over again, just to be able to follow them. Accidentally falling asleep while even talking was a problem. And so I went from this 20.6 to is a 4 with Inspire. I would stop breathing before 74 seconds at a time. So my mild cognitive impairment symptoms, weren't getting any better. But after Inspire, after the first night after activation, I was able to get a full night's sleep. And it was the first time I felt like I got restorative sleep in my life. And while my results aren't typical, I would say that it was a dramatic change between me before Inspire and me after. And then I started with my device at the level 1, which everyone's level is customized to them, and then slowly titrated up the device, but to get to the top level, to my therapeutic level. And then I went back, and I slowly did that because it's not a sprint. It's like a longer, slower pace. And so I would move up the remote as the doctor recommended, and then their comfort setting, so it's not uncomfortable. And then I went back for a titration sleep study, and that's when we found out that my 20.6 AHI went to a 4. And I would say that my symptoms of mild cognitive impairment started to go away 3 to 4 months from then. And then I also was taking a pill to stay awake for about a year previous to that, and I was able to stop taking that after that first night after activation. I felt that good, and I went from not knowing if I was going to have a future and a potential future diagnosis of some form of dementia to now I'm a store manager of a Petco, which is why I kind of got wrapped up in something and wasn't even looking at my phone. But luckily for me, I've been able to be very active. I have an active work life and social life, and I'm living and not just surviving. And the reason I decided to become a patient ambassador and volunteer, as I have been for about 5.5 years, is because I didn't want anyone to suffer through unsuccessfully treated sleep apnea like I did for any longer than they have to. And that this device doesn't work for everyone, but for the people that it does work for, it works really well. And I would say that if you're thinking about it, it's great to go get a consult to find out if you're a candidate. There's very, as you've probably heard, just a lot of criteria that you have to meet. And I welcome any questions. And then also there's an ambassador, there's a page on the website. It's inspiresleep.com/ambassadors. You can ask questions of any of the ambassadors on the page. I'm the last one on there. And then they send the question to us, and then we can answer it. But if you want to find out about anyone's patient experience, that's a resource available to you. And then the only other thing I wanted to say was thank you for logging in, and thank you for being patient with me logging on.
No problem at all. Thanks, Karen. Really appreciate you coming on to share your story with us. It's really impactful to hear from a real Inspire patient who's been using therapy now for about 6 years, coming up on 6 years. So Thanks again. That's awesome. Actually, we do have a question for you, Karen, that just popped up. What is the thing that most concerned you about the whole procedure and Inspire before the procedure? What were the things you were considering before the procedure that might have concerned you?
Well, I think that I was really bad off and was quite frankly suicidal before. So when I heard about the procedure, it took me a couple minutes to decide that I wanted to do this, and that I was just hoping I would qualify. But my family members were a bit taken back by that. My mom said that she wouldn't do that, and I told her, well, it's a good thing that it's me and not you. And at the time there were only 3,000 patients, so I could understand why she might have felt that way, about something new. But Inspire has so many more. What is it? Over 60,000 patients have Inspire, and I would say that I was a little bit concerned about going in for the procedure, but I think that now that I've been through it and I've talked to thousands of patients that have had it, I would say that my concerns were pretty unfounded. But also it is a surgery, and you're going to be under anesthetic, and just like with any other procedure, there's risks in that. So I did, take the time, and it took me a long time to get, I got medically cleared pretty quickly, but it took a long time to get insurance to pay. And now insurance pays pretty quickly, or agrees to pay pretty quickly, because that has all changed. And I would say that the other patients that I've talked to would say that I asked them, like, what would you do different? And they said I would have done it earlier, maybe. But I have a lot of apprehension about when I tried CPAP and BiPAP, and I was very uncomfortable, and it made my insomnia worse, made me feel worse. I never felt like I was getting good treatment. So I would say that caused a lot of anxiety for me. And a lot of patients I talk to are anxious because everything they've tried so far has not worked. So I would say that this procedure really does for me what I can't do for myself, which is move my tongue out of my airway so I can breathe at night. And no matter what I do, I can't do that by myself. So it's just, for me, it's been like life changing. And for many people that I know. So I would say that, like, I understand people have fears, and that's pretty normal. But that's why I think we have the patient ambassador page, so you can ask those kind of questions about people's experience, to make sure that you're comfortable with that decision.
Mm-hmm. Okay, thank you. And as we wrap up, folks, just to reiterate here, if you'd like to schedule a consultation with Dr. Mehdi-Zada, we have his 2 offices right here. Simply just call the numbers listed below, and he's happy to speak with you about it, whether it be Inspire or any other treatment to help treat your sleep apnea. So that is all of the questions and time we have for today. Thank you, everyone, for joining. Thank you, Karen, for coming on and sharing your story. And thank you so much, Dr. Mehdi-Zada, for your presentation as well. Thank you so much. And everybody else, have a great rest of your day.
Thank you.
Thank you.
Take care. Bye-bye.